Hello, and welcome to another one of our amazing health talks. I'm so excited about this opportunity to be here today with a very special guest speaker, Billi Niemeyer. She is amazing, and I love her heart and her heart for serving people. I met Billi a couple of years ago at her first event when we were talking about activation and helping people get to the root of their problems, and that was where I really saw her heart and her passion for truly helping people get to their root. So I want to introduce you to Billi. My name is Amy Dippold. I'm super excited to just be here with you guys. And I hope that this is informative for you because our goal is to help empower people to make informed choices over their health. Truly, that is our mission, and in any way, capacity that we can do that. And today it's going to talk about Your Blood Doesn't Lie, is the title of this. And Billi's going to dive into that. So a little bit about our amazing guest speaker today, okay? So Billi Niemeyer, she is a nurse practitioner, but before that, she started as an ultrasound tech and a vascular tech. She has worked at Mayo Clinic, and she has, after many years of pursuing her degree, she got really excited to become a nurse practitioner. And she has extensive background in taking care of people with varicose veins in treatment and hormone therapy. She's also a legendary certified buyout provider, and her background has really influenced her to where she's at now in her own practice, helping people with their overall wellness for their mind, body, and soul, which is part of the name of her practice. So I'm so excited to have you here today, Billi, and I really just want to hand it over for you to teach us about what is going on with our blood work. Enlighten us today.
All right. So to share my screen, am I able to share with you then?
Yep, just click share.
Uh, you. All right. Thank you, Amy, and thank you everyone for joining us tonight. So, like she said, blood does not lie. At my practice, we start everybody with a blood draw because it gives me guidance, it gives you guidance where you're deficient, what needs help, and what we need to improve. I always tell people don't settle to be in the normal range, you want to be optimal. So, we'll kind of go over all the blood labs that we do here and kind of go through everything. So, we'll start with that. So I always say treat the patient, not the paper. So what that means is when you get your blood work back, there's going to be ranges, and they always say normal, but when you look at it, it's actually reference ranges because it's not really a normal, it's just where you should fall in between. But when we look through some of these blood values, you're going to see a lot of them are pretty big. So yes, you might be in the reference range, but are you on the high side or the lower side? So this means, going a little bit deeper. And if you're symptomatic, treating if you're on the low side or if you're too high, figuring out why you are too high. So we want to get to the root cause and not just treat the symptoms. So that's the important part. Listen to your symptoms. It's the first step in getting better. So like I said, we don't want to put a band-aid on everything. We want to see, why are you feeling tired? Why do you have joint pain? Why do you have weight gain? Why are you irritable? Why do you have brain fog, sleep issues, and so on? A lot of times your labs can help give us guidance for that treatment. And you want to find a provider that listens to you and your symptoms to treat it. So like I said, don't settle for being normal. If you don't feel good and they still say, "Oh, you're fine, it's normal," I would just recommend getting a second opinion because if you're not feeling good, there's a reason for it. So what should be checked? CBC, CMP, those are pretty common. A lot of times that's what you get checked when you go to the doctor, but doing a full thyroid panel, which will go over a testosterone, a free testosterone, a SHBG, FSH, estradiol, B12, ferritin, iron, homocysteine, vitamin D, magnesium, lipid panel, insulin, A1C are my basic that I get with everybody. We don't deal with insurance or cash pay, so I try to keep it as cost effective as possible with getting as much information as possible. So these are our basics. So what is a CBC? It's a complete blood count. It's a group of blood tests that measures the number of blood cells in the body, and it just gives us an overall guidance of issues such as like anemia or B12 deficiencies or infections. RBCs, like what's carrying your oxygen in your blood, white blood count, we all know what that is if you got an infection. Hemoglobin is your oxygen, and hematocrit is the amount of red blood cells in your blood. Platelets is your clotting, MPV, MCV, and the MCH are all like your corpuscular volume size. So if they're off, they can give us guidance in what's if you're deficient or if you have inflammation, just to kind of do some further testing. And then the RDW is the degree of difference in your red blood cells, because if they're off, then something's off in your body. The CMP is a comprehensive metabolic panel. This gives us a lot of information on your body balance, the blood sugars, your electrolytes, your kidney and liver functions. Glucose is your blood sugar. Electrolytes are like your calcium, your sodium, potassium, carbon dioxide, chloride. And if those are off, you're going to feel off. It sounds so simple, but sometimes when you're dehydrated, it causes a lot of problems. So just that basic test can tell that. And then the kidneys, your BUN, your creatinine, and your GFR are great markers to show kidney function. So that's in your CMP. Albumin and total protein. This helps with muscle, bone, blood, and organs, so that's always good to check. Liver test is in this panel, and that's your alkaline phosphatase, AST, LT, and bilirubin. So that shows if there's anything off with your liver. I always add in an amylase and lipase. That is your pancreatic function. We all know it's a big insulin world right now with the shot. So I just want to get a baseline to make sure your pancreas is functioning okay. And just because if those numbers go up, you can have some issues with your pancreas. So it's just good to get a baseline. Thyroid. Thyroid is a little guy that does a lot. So a lot of times you get the TSH drawn at your doctor's office, and that's thyroid stimulating hormone. So that's actually in your brain controlling these thyroid hormones. So T3 and T4 are actually your functioning thyroid hormones. So those are very, very important. T3 is like your checking account. You're using it every day. Okay. T4 is your savings account. Okay. So to use your T4, you got to pull out of it. You got to pull out of your savings account. So to do that, your body has to use the reverse T3. So sometimes if people aren't, doing well, if we treat your thyroid, I'll have to check a reverse T3 to see what's going on. Because a lot of times the medicines like levothyroxine, Synthroid are only a T4 medication. And so you might be taking a high dose of that, but your thyroid is just still not feeling well, or your TSH is off. It's because your body's not converting that into your T3, what you're using. So T3 is so important. I can't express that enough. I also check a thyroid peroxidase antibodies because this helps diagnose autoimmune issues like Hashimoto's, which is low functioning thyroid. And a lot of times their TSH, T3, T4 are actually pretty good, but this antibodies is super, super high. So what that means is your thyroid hormones, it's working but it's not getting absorbed in your gut. So here comes the gut health. It's so important. Um, it's just hanging out in your blood. It's just not getting absorbed in your cells. So a lot of times it's just a simple probiotic or just autoimmune diet that will help with that, the Hashimoto's, and it is reversible. So it's just a good detector to check that. So TSH, like I talked about, is the hormone in the brain. It's like a mom yelling at the kids, the thyroid, like, hey, you need to work more. So this kind of confuses people. The higher the number that is, which the range there is 0.5 to 4.7. So it's a pretty big number. So the higher that number is, the mom's yelling. She's like, you kids are not working. The thyroid is not producing enough hormones. So when it's high, you're low functioning. When you're low number, you're working pretty good. Or sometimes if it's too low, you have hyperthyroid, too much. So like I said, it's a fun fact that TSH is not actually a thyroid hormone. It's just a stimulator. It's actually in the pituitary gland. So, I mean, it's a good tool. It gives us guidance where your thyroid's sitting, but it's not the only tool. So more has to be investigated. Even if they say you're normal, it may not be normal. There's so much more to the thyroid that does so much. It does metabolism, joint pain, cold hands and feet, hair, skin, and nails, a little anxiety. So it covers a lot of parts in your body. Testosterone and free T. So a lot of women don't even realize they have this in their body, but we do. It protects your bone, brain, breast, heart, and relationships. It does a lot with your mood. So women, your range is 5 to 55, but I really, really focus on the free T more than the total T because free T is what is getting in your cells. So that range is 0.2 to 2.6. And when we do the hormone therapy, we get you definitely higher. We get you in that 2.6 to 3.5 range. We want you to, to feel good and feel optimal. Men, your total testosterone is higher. You have more of it. It's 200 to 900. Look at that range. So many guys will come in and be like, they said I was normal, but they're down in the 200 range. So again, I look at that free T for them as well, and we want them, closer to that 20 range. So as I said, testosterone, it's huge. It's in men and women. There's large amounts in men. Men ages 37 will lose it. 1 to 3% production per year. Women ages 20 to 40, we lose 50% per year. So it's just huge. Once we start losing it, it really affects us. As you can see, there's a receptor everywhere in our body for testosterone, like the brain, the eyes, your stomach, everywhere. So it affects a lot. So it's always good to get a baseline of that. SHBG is your sex hormone binding globulin. So it's a protein that carries those sex hormones in your blood. The range is 10 to 57. So my analogy for this, it's like a school bus driving in your body. Okay. So if your number, your SHBG is high, it is taking a lot of your hormones. So this gives me guidance like, okay, if that's high, you're going to have to be dosed a little higher to get into your cells. If it's low, you're not going to need as much because your body's absorbing it. Why would it be high? Why would it be taking more hormones? A lot of times, vitamin D deficiency causes that. So that's another reason why that's important too to check that, which we'll get to. FSH and estradiol. FSH is follicle stimulating hormone. So that's again in the brain, kind of like the TSH. Another mom yelling at the ovaries about estradiol. So, and then estradiol is a hormone that supports reproduction. It helps with your heart health, regulates body temperature, and it helps produce collagen. Another fun fact, men do have estrogen, surprisingly, no. But when we do testosterone therapy, it can break down into estrogen. So that is why if you're doing hormone therapy, you need to get a baseline. Because if they get too much estrogen, that's when they get a little more emotional and some other side effects happen that they do not want. So we got to get a baseline of estrogen, or sometimes adipose tissue. Heavy men will have high estrogen levels. So it's important to monitor that and get that down. And there's good supplements to help with that, get that down. Like I said, FSH in the brain, we usually want that to be, they say less than 23. I want you to be like right around 23. We don't want that mom screaming. We want that number lower. Again, it's opposite. Estradiol, I like the ranges around 20 to 60. Estrogen is a touchy subject with a lot of things. People say too much can cause cancer, which, when you do have cancer, it can feed it. So it is important to monitor that, which we always do. But it's sad because on the range it says for postmenopausal, less than 10 is normal. And when you have low estrogen, you're going to be feeling like the hot flashes, insomnia, irritability, some weight gain, vaginal dryness, hair, skin, and nails, dry eyes. You're losing your collagen. So, yes, if you're less than 10, you're normal. But if you're having all those symptoms, you got to have your body's crying, saying, I need a little bit. So, and when people do have breast cancer and it's estrogen dominant, we do not give any estrogen, but it is just a good baseline to check that level. And sometimes when you are estrogen dominant, that's important to know too, because you need to calm that down or figure out why you are estrogen dominant and follow through with that. Homocysteine is one that we check. It's a good inflammation marker. It can show risk of cardiovascular disease, and it's a key marker for methylation. Methylation is a biochemical process in the body that plays a role in a lot of biological processes and diseases. If you don't methylate, you're not breaking things down. So we want that less than 8. And sometimes if it's too high, it can be something simple like you're deficient in B12. So just bumping up some of those things can just really help with inflammation in your body. A lot of times if people's homocysteine is high, protandim is great for everything, but it just can really help lower that inflammation marker in your body. Ferritin, iron, B12, so important. Ferritin is blood protein that contains the iron, so it's what's storing in your body. And then iron is the key component for hemoglobin, protein in your red blood cells. It carries the oxygen, it helps with hormone function, and it helps that conversion of T4 to T3. So, as we talked about, the thyroid does so much, but here's the pyramid. If this is deficient, your thyroid's not going to function. So, a lot of times, if you're deficient in this, I treat this before we throw you on any thyroid med, because this is just a key factor. When you're anemic, this is low iron. You're tired, you're fatigued, joint pain. It's just you. It's a game changer if you're low. Hair shedding is a big one with low iron too. Nails, brittle nails. Um, so that's always good to get, especially ferritin. Iron, I have seen where iron looks okay, but your ferritin's low because that's what's getting absorbed. And again, that can go back into gut health. B12 is huge. It's huge, essential for nerve production, cell metabolism. It helps with energy. Fat burn, it's got all the B's in it. B's are important. A lot of times when you're doing the weight loss shots, you're very deficient in B12. If you got tingling in your legs, bumping up B12 helps. It's just, we have just your B12, it's just your boost of energy. So it's always like if you're feeling down, just bump up with the B's. Axio's got the B12 in it, so it's always a good burst for you. Vitamin D is huge in our body. We all know it's mood and immunity, but it helps with bone development and it helps with hormone absorption. The range is 30 to 100, again, a big range. I like you to be around 70. And in the winter, we're not getting any sunlight, so it's always good to bump up your Ds, at least 10,000 units a day in the winter, 5,000 in the summer. But definitely get your Ds. Magnesium is another one that we like to check too. It's a crucial mineral that's involved with so many bodily functions and muscle, nerve, blood pressure, helps relax you, helps with sleep, helps with bowel movements, helps with bone health, it helps with your energy, it helps with hormones. So that range is really pretty reasonably small. But if you're low or high, it can cause some health issues. So it's always good to monitor that. If you are doing supplementation, you don't want to get too much of it. Lipid panels are important. It's your total cholesterol. LDL is your bad one. That's what builds up in your arteries. HDL is your good one. I always remember happy and H. So you want that one to be high, above 40. Triglycerides, that's what can cause the heart disease and the pancreatitis. That's like your sugars and carbs. So you just want to monitor those. Insulin and A1C. Insulin is what regulates your blood sugars, like we talked about the pancreas. So insulin breaks down sugars. It can help diagnose diabetes and insulin resistance. So when you're, excuse me, high insulin, that can indicate insulin resistance. A1C is a blood test that measures the average blood sugar or glucose over the past 2 to 3 months. So this one's really good because it gives you an average. Because sometimes if you run a glucose, and someone comes in and they're like, oh, I had coffee and a donut, your glucose is going to be sky high. So this A1C is a good average over 2 to 3 months, and it helps diagnose diabetes. So normal is below 5.7, pre-diabetics 5.7 to 6.4, and when you're above that 6.5, then you're considered diabetic. So it's always good to get a baseline of that. So at the end of the day, do not settle for normal. You want to feel optimal. Life's too short. We gotta have feel good. Optimal reference range helps you clue into potential imbalances sooner so you can be proactive instead of reactive. So check your labs, get your answers. With your answers, you can get a plan, and that's when healing happens. If your body is telling you something, you got to trust it. What's normal for one person isn't always normal for you. So listen to your gut, listen to your symptoms. I tell patients it's your body, you're the boss. I'm here to give you guidance and the tools to help. And like we said, blood doesn't lie. So listen to your body. Thanks.
I love that. And so I just want to take a couple of minutes in closing this up. Like that's a lot of information, and it just let me see if I can do multi-speaker here, or here we go. This is a lot of information, and I was just taking notes, and I know for our viewers, it's like, oh my goodness, like that's a lot. But here's the beautiful thing is like she kind of broke that down for those of us who really go in, we don't really know. And it's helpful to have that list to like really look at it because somebody like Billy, a provider can look at that and be like, okay, this is something we need to look into, right? Like, here's a starting point. And things, as some of our listeners, they're on this health journey. There's a lot of nutritional tools that you can use, and then providers have additional tools beyond that scope that they can use for interventions as well. And some of the key things that I wrote down in listening, like in what she's looking at with these blood panels, is gut health. Are we addressing our gut health? Are we absorbing what we eat? Are we absorbing what we take? It's one thing to take a ton of supplements and you're flushing it all down the toilet versus let's address the root and get to your let's have your gut working for you again. Then you don't need so many of those supplements because your body's going to take in that nutrition. She talked a lot about vitamin D, and I think that that's really important. I love the D that we offer because it has K in it as well. And I've seen a lot of people who were deficient not be deficient anymore with that blood work. And I love blood work as a baseline because they can come in and see, okay, this is where I'm starting. And then 3, 6 months later, we can reevaluate. Like, how often do you do blood work, Billy?
So if they do hormone replacement, I do a month later. But if you're doing like lipid panels, it's like 6 months. And
Six
then I
months.
do yearly for everybody.
I love that. That's so good. So then, yeah, reiterating gut health, she talked about the inflammation. What causes that? That's the oxidative stress. And like that's where she mentioned protandum, methylated B vitamins, because most of our bodies need that methylated version in the Axio. I love the Rise AM and Reset PM to help with like the different what we need to wake up, and then that magnesium when we go to bed. And
Mhm.
then insulin resistance. I mean, we all know why we're talking about with insulin resistance, but also like just bringing that gut and that brain. And when you talk about the hormones, like what's happening in the brain, if we don't have the gut brain connection, that's all throwing
Mhm.
everything out of whack too. So it's just so beautiful to see how you talk about that blood work and how it can all come together and just really help put the pieces of the puzzle together for people and where should they focus. And I just love and appreciate that. So let us know how this information helped you today, and also let us know your questions. We're always here. We want to achieve wellness together and continue to learn and grow. And Billy, is there anything else you'd like to say before we close?
Thanks for your time. I know it's a busy time of year, so I appreciate it.
Thank you for your time. I really, really love having experts like you in our corner who are truly advocating for their people. And like you said, like empowering people to feel like they're being heard and seen and that they have more control than what they thought
Yes.
they had. They really, really do. So thank you,
Yeah.
everybody. Have a wonderful night.